in the ovarian cancer world, since the introduction of PARP inhibitors and potentially non-standard, IV chemotherapy drugs, we're always hoping that we can offer patients treatment that is not, IV cytotoxic chemotherapy. And so, especially in the recurrent situation, if you can offer a patient something non-traditional that's not associated with toxicity and has an advantage therapeutically, that would be ideal for a recurrent ovarian cancer patient. So, I think this study had the intention of being able to tell treating physicians that we could give a patient a non-standard cytotoxic chemotherapy and be as effective, with limited toxicity. So this trial had 3 arms. It was basically for recurrent ovarian cancer, basically chemotherapy, standard, physician's choice chemotherapy versus olaparib, cediranib versus olaparib. Obviously the hope was maybe we could do better with non-standard chemotherapy, or potentially at least demonstrate efficacy and equivalency for a non-standard IV chemotherapy combination. Now, from what I can tell, the results were potentially not as practice changing as they would have hoped. It seems like maybe the tone was that there was a little bit of disappointment that the olaparib cediranib arm didn't look more beneficial than chemotherapy alone. That's sort of the tone that I got from it. But actually, what was interesting to me was in the BRCA, germline BRCA mutated patient population. Potentially, there's a superiority of the olaparib cediranib combination versus standard chemo alone. But there's a couple things. There's a couple issues with that statement. And one statement is that the study was done when we weren't using PARP inhibitor maintenance, and all of us pretty much know now the sooner the better with the PARP inhibitor. Meaning, if you're going to use a PARP inhibitor, if you've decided that that's a good thing for your patient, it's probably better to use it sooner rather than later to get the most benefit out of it. So that study is kind of not so relevant these days, in that we're now using PARP inhibitor frontline, even potentially in an all-comers patient population. So to have a patient that hasn't been exposed to a PARP inhibitor for their recurrent disease is pretty unlikely, especially in the BRCA germline patient population. And, not surprising that those patients potentially benefit more from PARP inhibitor than standard chemotherapy. So, I think it's interesting to consider a non-standard chemotherapy regimen, but I don't think that maybe this is practice changing. I think it's interesting, but potentially not practice changing. And the other thing I want to mention is that the non-traditional adverse events or side effect profile in the combination olaparib cediranib arm was higher than I would have liked for the non-hematologic toxicity. So, if you're going to use this combination olaparib cediranib, I think don't just write it off that it's non-traditional chemotherapy, it's better tolerated. Actually, potentially you'll have more non-hematologic toxicity in that combination, and really have to pay attention to that, which I think is important to remember. But hopefully, future studies will give us more information about non-traditional cytotoxic chemotherapy regimens for recurrent ovarian cancer patients.